So warm welcome here in our studio in Serekunda. This is Star TV News and I am Dado Cham. In the headlines tonight, Governor's Office in Upper River region has confirmed a positive coronavirus COVID-19 case in the region on Tuesday. Price control on essential commodity introduced in the Gambia by President Barrow. On the COVID-19 virus, students struggle to adapt to learn via radio and television at home. On the international scene, Nigeria imposed restrictions amid steep increase in COVID-19 cases. As coronavirus spread in Europe, hospitals are overwhelmed. Trump despite virus warning wants U.S. back at work by April 12. Those were headlines, and now the news in details. The Governor's Office in Upper River region, URR, has confirmed a positive coronavirus COVID-19 case in the region on Tuesday, with increased the tally to 3 so far in the country. Maimuna Juf reports.
A 71-year-old Gambian of URR origin, Numuel village, who recently returned from France, has been tested positive for coronavirus, bringing the number of COVID-19 cases in the country to 3. One of them died. The Ministry of Health said the 71-year-old arrived in the Gambia from France 17th March. The local authorities are currently contemplating the necessity of getting the entire community quarantined in order to control the spread of the virus. This is the third confirmed case of COVID-19 in the country. The first confirmed case is a lady in her 20s who is positively receiving treatment at the Medical Research Council MRC, while the second case is a citizen of Bangladesh who passed away as a result of the virus. Meanwhile, the Ministry of Health wants the executive to order for the suspension of all congregational prayers in the country. This request came after the Kingdom of Saudi Arabia banned congregational prayers in mosque and sequel to the Gambia government's confirmation of the first death as a result of coronavirus on Sunday evening involving a 70-year-old male Bangladesh national. Modunjai, Director of Health Promotion, said their next step is the fumigation and shutdown of Markaz, where a second case was identified, as well as shift work of 1025 hotline handlers, contact tracers, RRT members and other EOC members. He lamented that funds are yet to be released for COVID-19 coordination and response, asked if the country is planning to declare a state of emergency anytime soon. The International Monetary Fund yesterday disbursed $6.7 million to help the Gambia deal with the challenges posed by the coronavirus disease COVID-19 pandemic. The executive board of the IMF has also approved a 39-month extended credit facility arrangement for the Gambia in the amount of $47.1 million, or 56.3% of the country's quota, in the fund to anchor microeconomic stability and progress on structural reforms achieved under the 2019. The World Bank has also pledged $10 million in the country's fight against COVID-19. Reporting for Star TV News, I am Maimuna Juf.
The Minister of Justice has released regulation Tuesday signed by President Adama Barrow that empowers law enforcement to arrest and prosecute any business person who is found handling essential commodities in the country. Winter qualifies in this report.
The prices of the basic food commodities such as rice and cooking materials and other non-consumable items such as soap and hand sanitizers have been skyrocketing in the local market amid the coronavirus outbreak. Offenders will be fined $500,000 upon conviction, while vendors will have their trade license suspended after their arrest and revoked upon conviction. In exercise of the powers conferred on the President by Section 3 of the Emergency Powers Act, these regulations are made, the statement indicated. It may be cited as Essential Commodities Emergency Powers Regulation 2020. This regulation shall subsist until the end of the proclamation of public emergency issued on the 18th March 2020. The wholesale and retail prices of all essential commodities are hereby frozen to the prices they were sold in the open market as at 18th March 2020, as specified in the schedule of this regulation. Essential commodities are rice, maize, millet flour, sugar, milk, bread, chicken, egg and meat, fish, cooking oil, potato, onions, tomato paste, cement soap, and hand sanitizers. In the Essential Commodities Emergency Powers Regulation 2020, A person shall not hold any essential commodity in any way, shape or form. A wholesaler or retailer of an essential commodity or a person employed by him or her shall not refuse to sell such commodities or give any other indication which could not reasonably lead the purchaser to believe that he or she has not got the commodity, etc. While businesses are prohibited to hoard commodities, they are entitled to refuse selling large quantities of commodities to an individual if they reasonably believe that the quantity is beyond the buyer's need. The regulations have also prohibited the export of essential commodities outside the country. A person who breaches a provision of these regulations commits an offense and is liable to conviction to a fine of $500,000. A vendor or essential commodities who breaches a provisions of this regulation shall have his or her trade license suspended after his or her arrest and revoked after his or her conviction. For Star TV News, I am Binta Koli.
The coronavirus pandemic has gave birth to a new system of learning via radio and television for students introduced by the Ministry of Education. However, Star TV has made a follow-up on how the students are embracing this new method of learning within the Kanifing municipality. Modu Baji reports.
Following the suspension of education in the country due to the coronavirus outbreak, Education Ministry ordered students to be following lectures on both radio and television stations in the country. But some of the students are not in support of this system. They say a student highlights the challenges she is facing during this hard period of her education career.
Helpful at all. As they said, they are banning public garden. Some of the houses, when you go, they don't have TV. So some of the children, they have to go to other houses to watch TV. So if you say that you are banning, you are put across, or you are banning public garden, in this aspect, you can see that you are encouraging it, because some of the students, they have to go to their fellow men to watch the TV. So in that case, how are you preventing the spread of the disease? To me, I think this is not the way that they should do it, because some of the kids, they will go to their fellow colleagues to watch TV. At that stage, is that not public garden? Of course it is. So I can say this steps that the Ministry of Education has taken is not helpful at all. Because as you can see right now, one of my sister, she is at grade 12 grade 11 at this moment. So at this time, they are conducting their lessons on TV. She is busy doing works and stuff like that. So how will she find time to concentrate as the lessons is going on? So to me, this is not helpful at all. They should come up with another step that it will help to increase or help people or students with their education.
Ms. Cisse revealed that there are online classes at her school, but students hardly follow up those lectures due to the poor electricity supply and the high tariff on internet connection. She also alleged that the sound quality produced by the media houses are not accurate for her to comprehend much more a primary school going student. This system of education is introduced by the Ministry of Education in the midst of the coronavirus pandemic that has affected all sectors in the country. President Barrow earlier this week ordered that all schools across the country to be closed after a woman was tested positive for coronavirus. The Education Ministry has now engaged with all media houses to have lessons on radio and television stations across the country. Reporting for Star TV, I am Mondo Elbaji.
After confirmation of a third case of coronavirus in the country by the Minister of Health yesterday, our reporter went out on the street to sound the opinion of Gambians on the COVID-19 virus. Binta Koli has the rest of the details.
Biran Toure, who is worried of the rapid growth of COVID-19, said the government of the Gambia should do everything possible to look for a better solution to tackle this pandemic that has caused fear in the minds of every Gambian. He advised the government on some possible solutions.
Let them know, track where the disease is coming. All those traveling from where the disease is coming, it should be tracked, and every Gambian should be a police of his own. If you know this guy was not here in the country, please let them report to the emergency office and let the government take care of that. Because we are told that all those people coming with the virus, all those people coming should be quarantined, and everybody should be taken to quarantine. Because when Europe was there, nobody talked about it. They didn't think of coming to holidays. Because of the disease now they are coming, they should be subjected to quarantine. I really support the idea of taking them to quarantine.
Mr. Toure is in support of every measure taken by the government of the Gambia to prevent the spread of the COVID-19. But according to him, the 21-day suspension given by the president should really be looked into properly, as most Gambians and they are living from this public gathering.
Well, looking at that perspective, I am not here to contradict what the government says, but some public gathering, people get their earnings too. The government should also look at our earning, our means of earning. Like when you said public gathering 102, because sometimes we go to a shop, 3 or 4 people are there, looking at the space of the shops and all those things. So that's my contribution. I'm not there to contradict what the government have these things, but let them also look at the nature. Yes.
Malik Salah, who was also seen on the street of Serekunda, said, since the pandemic started in the Gambia, many people have used the opportunity to boost up their businesses in order to generate more income. According to him, even the small hand sanitizer that was sold $25 has now been increased to $200. Malik advised Gambians to use face masks and other preventive measures to prevent themselves from the deadly coronavirus, as stated by the Ministry of Health and WHO respectively. He also appealed that businessmen to reduce the price of their products, as that will help better the livelihood of Gambians. For Star TV News, I am Binta Kuli.
In a press release sent to media houses, the Supreme Islamic Council asked imams across the country to shut down their mosques. The release reads, the Supreme Islamic Council has asked imams across the country to suspend business in their mosques to help check the spread of the deadly coronavirus. The Gambia's coronavirus case currently stands at 3. 2 men and 1 woman, 1 died. SIC President Mohamed Lamin Toure said on GR2S on Tuesday, mosques across the country needed to shut for the safety of all Gambians. When a problem such as this happens, it's about being careful, and so when there is an order from the country's leader in that to prevent someone who is sick from transmitting it to others. Just the day before yesterday, there was a country where it killed 700 people in just 1 day. So Supreme Islamic Council is here today to plead with all imams for all of us to close our mosques and adhere to the government's order, Imam Toure said. The press end. And now news beyond our borders. There are concerned there is too much indifference towards the parliament in African most populous nation, Nigeria, has imposed restrictions in administrative and commercial capitals, following a sharp rise in cases and its first death. But the streets are still packed with people. Al Jazeera Ahmed Idris reports from Abuja.
Barrister Liberos Oshoma and his wife are forced to work at home. Their city, Lagos, accounts for nearly 66% of all confirmed cases of the coronavirus in Nigeria. He doesn't think he's getting the right information about the pandemic.
I would rather take my destiny in my hand and do self-isolation and stay indoor than wait for a government who does not even have information to give to me.
For 2 days, Al Jazeera is unable to get comments from Nigerian government officials. In both Lagos and the capital Abuja, government offices have been largely deserted, but not the streets and markets. More than half the Nigerian population lives on less than $2 a day. Most have to go out every day to earn a living. And the most skeptical about the coronavirus pandemic are in this category of Nigerians.
If at all there's something like there's anything coronavirus, it's for the rich men, not for the poor man. So we are free men and we continue to live free. So that's their business.
Nothing shows me that the sickness is this country. You understand? I'm proud of myself. I can't wear hand glove. I can't cover my. I cannot be breathing well because I'm hearing rumors from outside country that it's not my country.
It's attitudes like this that health workers say is a bigger challenge than the lack of capacity to deal with the virus. There is also concern about what they see on the streets. 4 passengers are crammed into this small taxi cab. The buses also aren't any better.
With health systems in desperate conditions, experts say most African countries are not prepared to deal with this pandemic. Nigeria, for example, has only 5 molecular laboratories for 200 million people, although the government says it's building more.
The government has announced a series of measures to contain the spread of the virus. These include closing all air and land borders, providing more testing kits, and asking residents to stay at home. That has not allayed concerns and fears of a big jump in the number of infections and fatalities in the coming days and weeks. Ahmed Idris, Al Jazeera, Abuja.
The coronavirus pandemic sweeping through Western Europe is overwhelming their healthcare system. A small percentage of medical staff in Spain and Italy have contracted the virus, while hospitals have run out of beds. So desperate is in need that the staff in Spain, Italy, and the United Kingdom has set up improved makeshift facilities. Al Jazeera Paul Brenda reports from Red Hill, southeast England.
1 in 5 Spanish residents is aged 65 or older, so the devastating impact of coronavirus in the country is no surprise. What's shocking is how the care system collapsed so quickly under the onslaught. Military emergency units are disinfecting premises as fast as humanly possible, as here in Madrid. But care home staff have been overwhelmed with desperate consequences.
I know the majority are fulfilling their duties. They are paying attention. But listen, this has to be said. The army, in some of their visits to the care centers, have seen elderly people completely abandoned, even dead in their beds.
With Madrid's hospital morgues full, this ice rink has been requisitioned to receive and store the bodies of the coronavirus victims. So infectious, even in death, that the staff are wearing full protective suits. In Italy, the latest clinic, repurposed as a coronavirus unit, has opened in Rome. Every single patient requires truly intensive care. Intensive in terms of staffing and intensive in terms of equipment. And there is simply not enough to go around. A growing number of Italian town mayors have recorded video messages, angrily ordering the public to stop flouting the lockdown rules. One mayor threatens to send in the carabinieri with a flamethrower to break up a planned graduation party. The shortage of critical care capacity in the UK is being at least partly addressed with a brand new temporary hospital being created in just 1 week at a huge exhibition centre in London.
The NHS Nightingale Hospital will comprise 2 wards, each of 2,000 people. With the help of the military and with NHS clinicians, we will make sure that we have the capacity that we need so that everyone can get the support they need.
For the first time, coronavirus restrictions are now having a tangible effect on millions of UK citizens. A stay-at-home order has replaced the previous advisory guidance, but not everyone seems to have grasped the urgency. This grocery store here in Red Hill is about the only shop that we found open in this town, but the lockdown is far from being strictly observed here, and maintaining it over what could be 3 or even 4 months is going to be a real challenge. And construction workers in particular show little sign of social distancing or other precautions. The example of this site in central London was far from unusual across the UK. But religious services of all denominations are banned. Wedding plans and baptism ceremonies are on hold. Only funerals will go ahead. This virus robs the joy from society and leaves only the grief. Paul Brennan, Al Jazeera, Red Hill.
US President Donald Trump said he wants the country open up and just raring to go. In a lift over 2 weeks, which will mean the lifting of the 15-day self-imposed guideline for coronavirus. But health experts are warning that this move could mean the number of infected will pick up as people return to their jobs. The Dow Jones Industry Average posted its biggest one-day percentage gain yet since 1933, also backed by speculation that Congress will soon improve to $2 trillion rescue bill. Al Jazeera Mike Hanna reports from Washington, D.C.
The New York Stock Exchange on an unprecedented rebound. Despite the fact that 1 in 1,000 people in the city are infected, the Dow posted a gain of over 2,000 points, the best day since 1933. Investors apparently believing that Congress was near agreement on a $2 trillion stimulus bill. President Trump asserting that the reaction was also linked to his expedited timeline for ending the shutdown across the country.
Today, as you probably saw, the Dow surged over 2,100 points. It's the all-time record history of the exchange. This is very encouraging, and I think part of the reason is they are looking at what is close to being passed, and I think a very big part of it is they see that we want to get our country open as soon as possible.
One economic advisor supporting the president's hope that anti-pandemic measures could be eased within 3 weeks.
If we can target zones where the virus is less prevalent, things are safe, we're not abandoning the health professionals' advice, but there is a clamor to try to reopen the economy and perhaps I'll call it less of a shut-in.
But the health experts are being a lot more cautious in discussing timelines, insisting that there's insufficient data to decide on even a partial lifting of shutdowns at present.
We need to know what's going on in those areas of the country where there isn't an obvious outbreak. Is there something underneath the surface that says, wait a minute, you better be careful and really clamp down? Or what looks there that you don't really have to be as harsh as you are in other areas. So it's looking at information that up to this point, John, we never had. So it's a flexible situation.
At the end of the day, no agreement in Congress either, a fact that could temper any renewed surge when the stock market opens again. Mike Hanna, Al Jazeera, Washington.
The legendary musician Afro jazz music Manu Dibango has died at the age of 86. That is after he contracted the coronavirus in France and was hospitalized last week. Al Jazeera Loure Badu Maki takes a look back at his life.
A musician and saxophonist known as Pappy Groove, a befitting name for Manu Dibango, who pioneered Afro jazz music and enjoyed a career spanning 6 decades. The French Culture Minister Franck Riester paid tribute to him on social media, saying the world has lost a legend and his talent knows no frontiers. His music inspired generations of musicians and musical genres, from 70s disco to modern pop and hip-hop. Born in Douala, Cameroon in 1933, Dibango moved to France when he was 15 and was gigging jazz music in Europe by the early 50s. But it was this 1972 hit that won him global recognition. The sounds of Soul Makossa pumped out of music halls across New York, leading to his first tour of the United States and fast-tracked his music to global recognition. It also earned him a Grammy nomination. Although his music was known to inspire many musicians, he embarked on a legal battle with Michael Jackson and Rihanna in 2009.
Everybody knows his song that was plagiarized by the great Michael Jackson, Soul Makossa. Everybody knows that. But my throat is tight because life is strange. Life is really strange. Manu Dibango today is gone.
Dibango toured across the globe throughout his career and collaborated with artists including Ladysmith Black Mambazo, Peter Gabriel and Sinead O'Connor.
Not only is it a talent that's gone, it's a part of Africa's musical history that's gone.
Dibango's music was in part inspired by the native sounds of his country, but the eclectic music drew inspiration from across the globe. He said he had the harmonies of Bach and Handel in his ear with Cameroonian lyrics.
The Prince of Wales has tested positive of coronavirus. Clarence House has confirmed Prince Charles, 71, is displaying most symptoms, but otherwise remain in good health. A spokesman said the Duchess of Cornwall, 72, has also been tested but does not have the virus. Clarence House said Charles and Camilla were now self-isolating at Balmoral, adding the prince has been working at home through all the last few days. More on this from BBC.
We've got some breaking news to bring you, and it's to do with the Prince of Wales. He has tested positive for coronavirus. We're told that he is displaying only mild symptoms, but otherwise remains in good health. That's according to Clarence House. So Prince Charles has tested positive for coronavirus. Mild symptoms, which is worth remembering. The scientists said only have mild symptoms, but Prince Charles has obviously been tested and he has tested positive for coronavirus. From memory, I think he's at Balmoral. To our royal correspondent, Sarah Campbell, any moment now. I'm looking on social media at other sources. That is the only information that they have yet so far. That Prince Charles, the Prince of Wales, has been tested positive for coronavirus. His office says he's been displaying mild symptoms but otherwise remains in good health and has been working from home throughout the last few days as usual. Camilla has been tested. Clarence House says she does not have the virus. Both Prince Charles and Camilla are self-isolating and they are at the Balmoral estate, as I thought, in Scotland. It's not possible, says Prince Charles's office, it's not possible to ascertain from whom the Prince caught the virus owing to the high number of engagements he carried out in his public role during recent weeks. And that's slightly more alarming. But yeah, Clarence House says it's not possible to ascertain from whom the Prince caught the virus owing to the high number of engagements he carried out in his public role during recent weeks. Prince Charles has coronavirus, Camilla does not. They've both been tested. Let's talk to Sarah Campbell, our royal correspondent. It's a bit of a surprise, this actually, isn't it, Sarah?
Well, I mean, literally the news statement's just been released from Clarence House. I can just read you what Clarence House spokesman has released, saying the Prince of Wales has tested positive for coronavirus. He has been displaying mild symptoms, but otherwise remains in good health and has been working from home throughout the last few days as usual. The Duchess of Cornwall has also been tested, but does not have the virus. In accordance with government and medical advice, the Prince and the Duchess are now self-isolating at home in Scotland. The tests were carried out by the NHS in Aberdeenshire, where they met the criteria required for testing. It goes on, it's not possible to ascertain from whom the Prince caught the virus owing to the high number of engagements he carried out in his public role during recent weeks. So just confirmation there from a Clarence House spokesman that the Prince of Wales has tested positive for coronavirus. The Duchess of Cornwall, Camilla, has also been tested, but she does not have the virus.
So they are at the Balmoral estate in Scotland. Where is the Queen right now?
The Queen is, she was moved to Windsor Castle. That was on Friday, I think, of last week. You'll remember the Duke of Edinburgh, who has been spending most of his time on the Sandringham estate. He was also taken down to Windsor Castle. So our understanding is that both the Queen and the Duke of Edinburgh are effectively isolating in Windsor Castle. And we hear that the Duchess of Cornwall and the Prince of Wales are in Scotland, where they are now self-isolating.
Because it does beg the question, has the Queen been tested?
Well, it does beg the question, has the Queen been tested? I mean, as I say, this statement has just been released. We're expecting to get some more details about this. The palace will give some more details because obviously both the Prince of Wales and Camilla, they're over 70. Of course, we know that the Queen and the Duke of Edinburgh are in their 90s, the Duke of Edinburgh 98. So there will be a huge amount of concern that if they were to get COVID-19, that potentially they're more susceptible to the more serious complications that can come with the virus. So there will be a lot of concern around that. And I mean, it was last week, wasn't it, that it was announced that the royal family were taking these steps, although they had been taking steps to protect themselves before that. We'd seen the Queen, for example, at an investiture wearing gloves, which she'd never done so before, but the decision was really taken last week. The meetings had to stop because, of course, what does the Queen, what does the Prince of Wales do? they go and meet people. That's their job, is to go out and to be seen and to meet people. And of course, that had to stop. And now we know that the Prince of Wales has tested positive.
You know, a high number of engagements in the last few weeks. When did he actually stop those engagements? Because we know that there is a 5-day incubation period for displaying symptoms for coronavirus.
We do know that. It's a really good question, and I'll have to go and find out exactly what the answer to that question is. I mean, certainly Camilla, the Duchess of Cornwall, from memory, she attended Cheltenham races. So I think that was the week before last. As far as I'm aware, that was the last time that she was out somewhere public. So they have been engaged. I mean, they were due to go on their spring tour, and that was cancelled. So they didn't in fact go away. But he was, he has been out and about. And certainly, as I say, it was sort of really last week the decision was taken not to go out and about. But I will have to look back and see when was the last time that they actually made a public engagement. It's not clear when he was tested or when he started to show symptoms. As I say, this statement from Clarence House does say that he's been working from home throughout the last few days as usual. So that does suggest that he was tested perhaps more than a few days ago if he's been self-isolating since then. So, you know, I don't want to guess. We're hoping to get some more information from Clarence House, from Buckingham Palace, about exactly where he's been, who he's been seeing, whether, as you say, that important question, you know, has he seen the Queen?
I mean, I can tell you there are pictures on social media of an event, a Prince's Trust event, that he was at a few days ago with people like Anton Deck, with Pierce Brosnan. They weren't shaking hands. I suppose that's the good news. They weren't shaking hands, but they were, you know, they were within 2 meters of each other. So, and that would be the norm for the kind of engagements he's been carrying out for the past few weeks.
Well, exactly. I mean, it's been it's been a balancing act for them as for everyone else. In that, you know, when the royal family do anything, then it sends a strong statement. So going into self-isolation sends a strong statement, and I think everyone was reluctant to do that until it would have been a sensible thing to do and something that wouldn't have caused adverse panic. But of course, everything with coronavirus has changed so dramatically over the last 2 weeks. You know, the things that they were perhaps doing would now be completely unthinkable. So, you know, like you say, them at an event with Anton Deck now would be completely unthinkable. But we don't know at what point yet he actually picked up the virus. I'm sure that hopefully we'll find out those details.
And before we end of the news, a recap of our main headlines. Governor's official in Ohio River region has confirmed positive coronavirus COVID-19 case in the region on Tuesday. Price control on essential commodities introduced in the Gambia by President Barrow. On the COVID-19 virus, students struggle to adapt to learning via radio and television at home. Nigeria imposed restriction amid sharp increase in COVID-19 cases. As coronavirus spread in Europe, hospitals are overwhelmed. Trump dispelled virus warning wants U.S. back at work by April 12. That's all for this edition of the news. Please enjoy the rest of our programs and join us for tomorrow's news. Thank you.